tasked this time to talk about the NHS Type 2 Diabetes Path to Remission program, previously called as the low-calorie diet. So I'll be talking around the background and the benefits of the Remission program. I have got John from Momenta, who is the current provider for the Remission program, and James, who is the health and wellbeing coach for Barnsley. The provider, John's going to talk around the roles and responsibilities of the program. James will be talking around the pathways, how to run clinical searches. Some problem there within the slide, sorry about that. And top tips. So background, the NHS Type 2 Diabetes Path to Remission program, previously called as the low-calorie diet, as you all know, is designed for people with type 2 diabetes within 6 years of diagnosis. Now, the program is based on two underpinning randomized clinical trials, the Droplet and the Direct. Both the trials showed that a program including a specifically formulated diet for 3 months, followed by a healthy lifestyle support, resulted in around 10 to 15 kilograms of weight loss at 1 year and retains remission of type 2 diabetes, which was achieved in half of the intervention group. And many of the participants also had improvements in the blood glucose readings and needed reduced use of diabetes-related medications. So as you all know, the evidence is now strong enough and our clinical practice should change. We should be in a position to offer our patients a realistic prospect that we can put diabetes into remission, and the program should become the first treatment option for many, especially the ones who are diagnosed quite early. So when we look at the benefits for the patients, as we mentioned around the trial results, the participants do achieve weight loss. We can put diabetes into remission. They probably would not need any medications if they achieve remission. Reduction in medications. It has a positive impact on the comorbidities. Healthy living and quality of life is improved. And more importantly, the total diet replacement products are free of cost. So what are the benefits of the general practice? It's a free NHS England centrally commissioned services. There is some payment through the weight management enhanced service specification into the remission program. The provider also do offer blood glucose monitoring, blood pressure monitoring, weighing devices. They also do have a medical director in place to look at non-urgent clinical queries, which means less burden within the general practice. And the providers do also offer extensive support to all the participants. So I'll let John come and talk around the NHS England approach and the Momenta Newcastle approach.
A little bit taller than you, Annie. James and I wanted to stand down there so it didn't look like Annie had bodyguards. But thank you for the sort of recommendation by Dr. Gandhi. I don't think I need to say much more than that. And it was really heartwarming to see how many people had already referred into the type 2 diabetes path to remission service. I see firsthand how many referrals we get from South Yorkshire, in particular Sheffield. So for some of you, this might be a little bit of a refresher. For others, this might be totally new information. But as Annie said, we do provide extensive support, so I'll keep this super brief. But if you do need any more information, then as a provider, we're only too happy to provide you with exactly what you need. This program's been going for the last near enough 4 years now, of which the delivery format has recently changed as of June of this year. As a provider, we've been delivering this since the very start of the commission service, of which we started delivering in groups in Birmingham. Obviously, we've already talked around diversity and being culturally sensitive and competent. That's exactly what we've had to do within a Birmingham context. So we've been delivering that for quite some time in groups, and even in Birmingham, which again is a really diverse population, achieving outcomes of around 13% of total body weight lost at the end of the total diet replacement phase at 12 weeks, sustained at 12 months. So that's absolutely fantastic. Within this current service as well, we are starting to get some cracking outcomes across South Yorkshire. The delivery format has changed ever so slightly. We now do not deliver in groups, but it is delivered patient choice, either one-to-one in person or our new digital service. Now, patients have the option of choosing one or the other service. It's about patient choice. We're finding at the minute there's a 60-40 split in favour of digital provision. That surprised us. We thought a lot more people would want digital provision as opposed to in-person, but in-person is still there. There's 3 phases over the 12-month supportive service. The first phase is called the total diet replacement phase. It is where participants will have an 800 to 900 calorie per day diet using 4 meal replacement products. They then go through a process of food reintroduction, which is 6 weeks, where every fortnight they will lose 1 product and replace it with a real meal. Finally, there's the weight maintenance phase, which is around 7 months worth of continued support to support the participant to sustain the weight loss they've achieved during the total diet replacement phase. We use a group called Exante. There are over 40 different flavours of shakes, soups, bars, meals. We cater for dairy, gluten intolerances, as well as a mixture of tastes, textures, flavours. And our app is powered by a group called Habitual. All of this information is on our referrer website, and I'll direct you to the link very shortly. But in broad terms, this is the inclusion-exclusion criteria. We've highlighted some of the things to be really mindful of in terms of the inclusion criteria. Aged 18 to 65, we do get a lot of groans at that point saying, I've got an ideal 66-year-old that would be really good at this programme. We've pushed NHS England as much as we can to accept anybody over the age of 65, and to be frank, they're having none of it. So the criteria is pretty rigid at 18 to 65, with a type 2 diabetes diagnosis within 6 years. Not in South Yorkshire. We actually had a referral pushed back to us because it was 6 years and 1 week. So it is pretty frustrating for everybody. HbA1c, so of between 48 and 87 or 43 if they're on diabetes medications. Biggest exclusion criteria is obviously current insulin use. So if they're currently on insulin, they would be excluded from the programme. Exclusion criteria as well, it's not just about eligibility, it's around suitability as well, and clinical judgment and assessment around whether this type of programme is going to be of benefit for a patient is paramount. So if they meet the eligibility criteria but you don't think they're suitable, then please do not refer them. So across the course of the programme, regardless of whether they're doing digital provision or in-person provision in local settings right across South Yorkshire, all patients will get 21 sessions. Now, each of those sessions will focus on something completely different. It's not they're going to be churning out the same thing every single session. So I won't go through all the sessions. There's lots of them. There's lots of interesting topics, and they will work through their coach either in person or via Teams call for our digital programme through all of these different topics. Both routes will get resources, they'll get booklets, they'll get label readers, pedometers. I feel like we're on the generation game now. They will also get, for people who go through the digital provision, they'll get blood glucose meters, as Annie's mentioned, blood pressure monitors if they're on hypertension medication, plus scales as well, and also access to the app. They get 4 voucher codes over the duration of the total diet replacement, so they can order their own products directly from Exante. Annie?
Yeah. Perfect. Thank you. Thanks for that, Joan. So what are the GP practice and the provider's responsibilities? A. Identify eligible patients and offer referral as appropriate. It's very important that when you are referring the clients into the T2DR program, that you provide information around the service and the potential remission of type 2 diabetes. Discuss medication change that needs to happen on the first day of commencing the T2DR, and you must also provide the written confirmation to the provider, including if there is no medication changes that is needed. Should be in a position to respond to the clinical need if further adjustment of medication is needed, respond to adverse events, and arrange review of the patients at 6 months and 12 months with a repeat HbA1c. I'll hand you back to John just to talk about the provider's responsibilities.
Practice what I preach and get the steps in. So in terms of our responsibilities, once somebody comes on our programme, I like to think they're exceptionally well looked after, and we will always sort of put their safety first and foremost above everything else that we do. Therefore, at every single session, once somebody joins one of our programmes, we will monitor blood glucose, blood pressure if required, and weight. We have threshold breaches in terms of BP and blood glucose, that if any of those thresholds are exceeded or fall below, that gets reported to our medical director, Dr. Ellen Fallows, who's a GP with a specialist interest in diabetes, based in Leeds. Sorry, Dr. Gandhi. But if Ellen feels that anything does need escalated back to the practice, then that will happen quite swiftly, and our clinical team will raise that directly with you guys. So, in terms of the in-person provision as well, that if we endeavour to try and provide service as local as possible, when you get to our referrer website, I'm really bigging up this referrer website now, but if you look at the referrer website, all of the venues we've identified that we can deliver from is on the website. Hopefully that should give you some confidence knowing that it's your patients will have something local and accessible for them. We do that to minimise patient waiting times and travel times. If you would like us to use your practice, we do have a very modest budget to pay for room hire. But if you've got a spare clinical room that you could rent out to us, speak to your admin team, and we've got a little link in there where you can pop that in, and then we'll contact you, and hopefully we can give you some pennies to use your room. Is this yours, this me? I'll keep going. So when it comes to identifying interesting patients, then there's 3 different methods that we can use. The search and invitation approach, which James will talk about in a second. Opportunistic, as you see people within routine consultation, annual reviews, health checks, etc. Or bespoke, where we can do bespoke patient engagement events where we can talk to your patients for you, give them everything they need to know to make an informed decision around whether this service is going to be a benefit to them. Right, I'll hand over to James on Arden searches.
So, yeah, Arden's clinical searches, like I said, most of you might know how to do this. There might be a few who don't know how to do it, so just quick step by step. So on system 1, you'd go to reporting, clinical reporting, then find Arden's Limited, go down to conditions diabetes, then it's down as LCD, there's obviously diabetes prevention programme there. We are in contact with Arden's to try and change the LCD to the path to remission. Eligibility criteria is slightly different, so if you do use an Arden's search, double check the patients, make sure they are eligible for the path to remission programme. So once it's up, it's normally the top one, you right click, click run, it'll then tell you the amount of patients. There it says 91 will qualify for the programme. You then click show patients and it'll bring all the patients up. on EMIS, population reporting. If that's not on, you click on the EMIS top left button, that'll bring you to the home page. I think it's then reporting, then population reporting. Same again, go down to the Ardens folder, conditions diabetes, and then choose whichever program, so LCD. Like how it says here, potential eligible, so that means you do have to double check them. Same, click it, choose whichever one it is, click the run in the toolbar at the top, and same again, it'll tell you how many patients qualify for that program. So that's how to do a quick Ardens search. No searches are perfect, so please review each patient before considering referring them. Just this, it prevents disappointments, and obviously referrals being rejected as well by the provider. So, top tip for increasing referrals, so I can't take much credit for this. It's more from Claire Thompson, which I have seen somewhere. I didn't know she was here today, but she's somewhere. So, what they've been doing in Sheffield, which some of you might have already worked with Claire, as well as Bernie as well. They've been doing their own searches, and they've been doing AccuRx, sending out a Florey questionnaire to these eligible patients, inviting them to the programme. So this is a visual step-by-step. Claire's also got a step-by-step on how to do this as well. So AccuRx, if you've already accessed this, I know some might not. You click your initials, top right, go down to managing organisations, then go into templates and Floreys, then medical centres Florey section, then go to custom Florey questionnaire, and then create your Florey if you haven't done one already. So this is what Claire's done. So you can choose add a question name, so whatever questionnaire you want to call it, so it could be a path to remission programme, it could be invitation, what question you want to ask them. In description as well, there's no limit, so you can write a bit more about the programme, what it is, so patients can see that. Then you can have multiple choice question, you can have them to write an answer, so multiple choice, quick one, choose yes, no, and so on. You can use SNOMED codes as well, so it goes straight to the patient record. It's quite good to then pull off reporting if you need to as well. Create an invite, so it's a bit backwards, so this step 2 will be the text message what the patient would receive. Same again, you can use SNOMED codes, so I know Claire uses weight management program offered. Step 3, create confirmation. So once they've completed the questionnaire, they will then receive this. Same again, you can put a SNOMED code. There's other links on there, so I know there's a digital weight management program, so if they're not interested in the path to remission, you can tell them about other programs what's on offer. Live Light is also the weight management one in Sheffield as well. Assign it to group, so you can assign them responses. Each practice might be different, so I know Claire's been using like the nurses, so the nurses in that practice would see the referrals come in, they can double check then that patient, and make the referral to that programme. Then save for testing. Like Claire says, you've always got to test on patients, so test on Mickey Mouse, make sure them links work as well. So how to send it then, so yeah, find your patient, this is sending individuals, choose the Florey questionnaire, so NHS path to remission, make sure you enter valid mobile, then it'll just automatically fill that in. Make sure you tick save to record, so it'll save that patient record. Mickey Mouse wouldn't obviously qualify for program, it's too old, but yeah, that's how it would work. So how it looks for a patient then, so that's what they get on the phone. It's from GP surgery with link on, they click that. It's all secure with GDPR as well, so they have to enter the date of birth, then it basically gives a message again. Then they basically answer the question, yes, I'd like to be referred, or I'd like the nurse to speak to me a bit more, or no, I wouldn't. Say they can click that link and read up a bit more about the Memento programme, so what John was on about, it'll take them to that page. Yeah, are they happy with the questions? So yes, submit, then that bit, like I said, what brings up at the end, tells them a bit more. And then that's it. So then it'll come to your inbox, so if it's the nurses, it'll come up as one there. Tell you that they've completed the survey, so on that one it'll say, yes, please ask a nurse. So then that's when nurse would then contact that patient, have a book them in, I'll speak to them over the phone, tell them more about the referral, about the programme, and then make that referral. Then that's how it'll look on system 1, so it'll be saved on there, the SNOMED codes will be all saved. as well, so then you'll be able to pull off reports from there. So I think that's me on it on that bit. Good. John's here for this bit, yeah? Pass on.
Thanks, James. The wonderful world of Arden searches. Cool. So just to surmise what we spoke about, seemed like a long time ago since the coffee break now. But in terms of making a successful referral, what James has just went through is that step one. Identify and assess sort of suitable and eligible patients for the programme and get them invited to the programme. Or you can do it opportunistically during annual reviews, health checks, etc., or at a patient event. The second step is actually doing the referral, getting the appointment with the patient, talking them through the referral and the medication adjustment form. Now, the medication adjustment form is a big piece of the referral form, and guidance is on our referral website on what medications do need to change, meeting the NHS England protocol. And then finally, send the referral to us and we'll get it. So in terms of searches, sense check it, make sure it hasn't come up with poor Mickey Mouse who was too old for the programme. We don't want too many of them. Screen for appropriateness. We do appreciate there's some historical coding issues. I've never come across a practice with perfect coding yet, and we work across the country. But if you do have long lists of patients, you might choose to refer them in batches. We've worked with a practice who identified within their PCN about 1,600 eligible patients and referring them in batches of 100 at a time, which could take us a while. So with the medications adjustment form and the referral form, confirm eligibility, ensure the patient has a copy of that medication adjustment form. These medication adjustment form changes to medication take place on the very first day that they start the total diet replacement phase and not before. We do have some confused patients that go, I've already come off all my diabetes medications. No! Only on day one, so they need a copy of that medication adjustment form. If no medications do need changing, that form still needs completed and the box needs ticked. This is the pathway of the service and around what happens once a person gets referred and what happens on the programme. And finally, all of this information will be circulated. Please have a look at our referral webpage as well. There is tons of information. We're also gathering success stories already. Oh, I've just broke that. We're already gathering case studies from South Yorkshire of people who started the programme and had some phenomenal results already. Under the previous contract, Annie was telling us that there was around they received 20 to 30 referrals per month. We are currently receiving 50 to 60 referrals per month and have capacity to accept more than that. So if you do have some eligible patients that you think would be appropriate for this service, please get them referred. But if you need any support whatsoever, please reach out and we'll be only too happy to support you as much as we can. Enjoy kidney disease.